Good morning, everyone. Happy Monday. Thanks for joining Indiana Ship for Medicare Monday. I'm Susan. I'm in Indianapolis, and Megan is my co-hostess as always up in Northern Indiana. Good morning, Megan.
Good morning, Susan.
Thanks for putting this terrific presentation together about the pitfalls with Medicare. There may be one or two, and
hmm
Megan is going to share those with us. There's things to consider, things to remember if we're new to Medicare or if we're an experienced Medicare beneficiary. Now, if you have questions, if you're live, you can chat them in and we will answer them. And if you're watching this on YouTube or later on Facebook, then go ahead and still ask us questions because we monitor those and we will respond. So, without further ado, fill us in on the pitfalls and then how we can avoid them, Megan.
Wonderful. Thank you, Susan. Let me get my slides up here and we will discuss those. All right. So these are things, the most common pitfalls. There could be other pitfalls out there, but these are the main ones that Susan and I see when working with Medicare beneficiaries. So these are things to know and to watch for when you're reviewing your Medicare plans from year to year or you're enrolling into Medicare plans. So first, let's talk about a few pitfalls to be aware of when you're enrolling in your Part A and or Part B. So when you qualify for Medicare, if you have large employer insurance through an employer, either your employer or a spouse's, you can delay your Medicare penalty free. But if you have small employer health insurance, you cannot delay. You can keep your employer plan, but you do have to take your Medicare. And if you have the employer insurance, there are some things to think about if you want Part B. So if you're keeping your employer insurance and you're going to go ahead and take your Part B and it's large employer, you would trigger something called your 6-month guaranteed issue open enrollment period for Medigap. So if you want to get a Medigap/supplement, when you go on Medicare, you want to keep your employer insurance. You do not want to take Part B yet because you will trigger the 6-month window for being new to Medicare and having your Part B for the first time. And you cannot get that window back. So if you trigger it, then you retire, it's out this 6-month window, then, and if you have health issues, they're going to do medical underwriting and you most likely will not be able to get a supplement. You also want to keep in mind that if you keep the employer and take Part B is secondary, and Medicare does not make for great secondary insurance. It will generally not pay anything out, though there have been some clients where I hear, oh, it paid a couple dollars here or there, $20. But you may still be stuck with $1,500 you have to pay. So keep that in mind. And here's the other thing that we run into, COBRA. So when you lose employer insurance, whether you're retiring or you went down to part-time, whatever, they may offer COBRA. Now, COBRA is expensive. You can have up to 18 months of COBRA. Some employers pay for COBRA. So when I see that the employer is paying for it, individuals are like, well, yeah, sign me up. I want free insurance. However, it's not creditable, which means it's not as good as or better than Medicare. So if you have the employer insurance, it's creditable if it's the large employer. So when you retire, when you lose that employer insurance, you have 8 months to get your Medicare set up, penalty free. Anything beyond that, you're going to get a penalty. So if you want to take COBRA for a few months, you can take it up to 8 months at the latest, but then you need to make sure your Part B is set up or you're going to run into penalties. And keep in mind everything that I'm going through are things that you can set up an appointment with a ship counselor to discuss one-on-one to look at your specific situation. Oopsies. All right. So Part A and health savings accounts. If you are contributing to an HSA and you are getting closer to getting Part A, you have to stop contributing to that HSA within no later than 6 months from your Part A starting. If you have contributed and it's under 6 months from when your Part A is going to start, you will get a tax penalty. And you can talk to your tax person about this. It's an IRS rule and not a Medicare rule. Now, you can still use the money in the HSA. Some people save up that money and they want to use it for when they retire. And you can. You can use it for some of your premiums, vision, dental, and hearing, copays and deductibles. The one Medicare piece that I know you can't use it to pay a premium for is your Medigap/supplement. All your other premiums, I'm pretty sure you can use the money out of the HSA. All right, so now we're going to switch gears a little bit. You're now enrolling in Part A and Part B. Now, Part B specifically has a 20% copay. Medicare pays 80, you pay 20. Now, Part B has no max out-of-pocket protection. That means you are going to pay that 20% forever and ever and ever if you do not have some kind of secondary insurance, whether that be retiree, TRICARE, Medicaid, or your two Medicare options, such as a Medigap or an Advantage plan. I had a client a few years ago. He just had A and B, and he had no secondary insurance. He had a medical emergency from East Chicago, which is far north, right next to Michigan and Illinois, basically. And he had an ambulance trip down to Susan's area. He had to go all the way to Indy in that ambulance. His 20% copay that he legitimately owed was $15,000. So make sure you are talking to someone like a ship counselor about your options. Because again, there's no max out-of-pocket protection. So that 20% is going to continue to go forever and ever and ever. And we want to try to make sure your costs are as low as possible. So that's another pitfall to be aware of. All right, so Medicare has enrollment periods. You basically have to be in an enrollment period to do whatever you want with your Medicare. So we have an IEP, which is the initial enrollment period, or an SEP, which is a special enrollment period. So if you're new to Medicare, you have a 7-month window to get your Medicare. But if you're still working and you have that large employer insurance, you may delay it, which is fine. But then you retire. And you should be using an SEP, a special enrollment period, to get your A and your B set up. But if you miss that, and that's that 8-month window, then you will have to wait for something called the general enrollment period. This only comes about January 1st to March 31st every year. So if you call us up in June and say, well, I miss my IEP and my SEP, but I want my Medicare, we're most likely going to tell you you're going to have to wait until January 1st at the earliest to get your A and or B set up. So that's the first thing. Now, when you call Social Security to enroll, let's say you do it in January as soon as you can, they're going to tell you that your Medicare is going to start the first of the following month. So if you do call in January, it should start February 1st. Now, they're also going to tell you you have a penalty, and we don't want that. But this penalty is for people who did not enroll in your A. Well, for some people, if you have to pay for your A, then you may have a penalty cost. But if you get the free Part A, you won't have a penalty. So it's mainly with Part B that you're going to see penalties. And for B specifically, it's 10% for each 12 months you went without Medicare Part B and you didn't have creditable insurance. So let's say we have a client, George, and George didn't take Medicare when he sort of no other insurance, he just didn't want to pay for it. He's healthy. 5 years pass, okay? George is now 70. George starts having some health issues. He decides to get Medicare. He signs up during the general enrollment period. That is 12 months that he was eligible for B and did not take it. George has a 50% penalty. And what's that 50% based off of? It's the Part B premium. So this year it's 202 and some change. So 50% of that is 101. So George is going to pay 303 every month for his Part B for his penalty and the premium. Now that will change every year as the Part B premium goes up. Now, there are some ways to avoid that penalty or make that penalty go away. And one of those is Medicaid. So if you qualify for Medicaid or what we call a partial Medicaid, the Medicare Savings Program, then that penalty might be able to go bye-bye. Otherwise, it's with you for the rest of your life. All right, so let's talk about Advantage plans now. So some things to keep in mind. Advantage plans have networks, probably like our commercial insurance that we've had when we were working. They have networks. So there's HMO Advantage plans. So that means you can only go in network, or PPO Advantage plans. And that means you have a little bit more flexibility. You can go out of network. In most cases, the doctor that you go to does have to take Advantage plans and be willing to bill the insurance provider. You would have to pay some higher copays if you go to an out-of-network PPO provider, but at least you wouldn't have to pay 100% of the bill. When you do pick a plan before you enroll, you need to make sure all your doctors are in network. Or at least if you go with a PPO, you know your out-of-network doctors will bill the PPO. Sometimes doctors and hospital systems decide to contract with new insurance companies or stop contracting with an insurance company. And they can do this throughout the year, even if you're not in an enrollment phase. I've seen it happen. A couple years ago, in July, one of the big hospital systems in my area decided they were not going to renew the contract with United Healthcare. So, of course, that was the popular plan up here, and everyone was calling. And unfortunately, for most of them, I had to tell them, we're just going to have to hope the contract does get signed soon, because otherwise we can't get you into another plan until fall open enrollment. And that is sometimes what we see happens. Contract is up, they don't sign it, they go back and forth. You're waiting for weeks to know if you can continue to see your doctors, and then magically they sign the contract and everything's good. I have seen that. I've also seen where the contract does not get signed. So you just want to be aware of that. You're making sure that you're looking at your mail. You're making sure that you're in communication with your doctor's office. Most doctors' offices are pretty good, at least from what I've seen, to let people know or send letters, hey, your insurance is going to be out of network in a few weeks. All right, so adding on top of that, you know now that your doctor is not going to take your insurance. What do you do? So if you are in a special enrollment period, you can see a SHIP counselor and we can help you switch to a different plan that your provider takes. Otherwise, you will need to stay with the insurance that you have until your next special enrollment period. Um, if you move, you go to a nursing home, those are all special enrollment periods, or the fall open enrollment, which is October 15th to December 7th. Now, these may not be good options, but some options that you might have is privately paying for your doctor's appointments, changing doctors. If you do have a PPO Advantage plan, you can see if the doctor or the hospital system will bill your insurance even though they're out of network. So again, you'd have a higher copay, your max out of pocket might jump some, but at least you would still be able to see your providers. All right, so what are some of our pitfalls when it comes to our Part D drug insurance? So one thing that I see from time to time is a client has been on Medicare for 10 years, 20 years, and they have a supplement and their drug plan is through the same insurance company as their Medigap. Now, nothing wrong with that. However, one client I remember, I was doing a presentation at an assisted living, and she goes, well, I'm paying $120 a month for my premium for my drug plan. And I go, okay, that's a little pricey. I said, well, what kind of medication do you take? She just took generics. Now, in most cases, I at least do not see clients just on generics having the most expensive premium Part D plans. It could happen. However, we generally see the more expensive premium Part D plans with people who are on brand names because those plans tend to not have the drug deductible. So it does make it cheaper in the long run. But she just had generics. So I said, well, this doesn't sound right to me. Let's set up an appointment. So we set up an appointment, put in her meds, put in her zip code, all that. Found her a plan where she would save, oh, well, about 1,500 a year because I think it was the $8 premium plan at that point, and then her generics hardly cost her anything. So, I was just curious. I asked how she got on this plan. She goes, well, that's who my Medigap company is through. So I wanted them to be with the same company. I thought it would be easy. Okay, fair point. However, make sure you're looking. Oh, I got an ad pop up, Susan. Hold on. Not sure what happened there. It's Monday, that's all I can say. Okay. So, um, now where was I? I got distracted. Hold on here. Part D. She picked it because her supplement. Okay. So make sure when you are picking your drug plan, you are looking at the other drug plans that you're available in your zip code. Because your medicine is really what really determines what is the most expensive and the cheapest for you. If you are just on generics, generally the lower cost premium plans are going to be the cheaper for you. However, if you're on deductibles, or not deductibles, Susan, I got thrown off with that ad blocker. I gotta get my brain back focused here. Okay. Um, if you're on brand name, there's variables with that. Deductibles, no deductibles, higher premium, lower premium. So just make sure that you're shopping around and just not going with the same company that your Medigap is through. Not enrolling in Part D when you're first eligible because you don't take any medication. Okay. Medicare doesn't care. They want you to have a drug plan, whether you take prescriptions or not. And just like B, if you're not on creditable drug insurance, then you would have a penalty later on for not getting your drug coverage when you're first eligible. So make sure you get a drug plan. There are some lower cost premium plans out there. So usually what I talk to my beneficiaries about is, okay, you're not on prescriptions. Let's get you on the $0 premium plan. You'll have coverage if you do get some prescriptions. And then the next open enrollment, we review your plan and make sure you're on the best plan for you at that point. So there are two ways that you can pay for your Part D premium. One is having it come out automatically through your Social Security, or you can get a bill. Now, you can do either one of these options, that's fine. However, what I have seen happen is client says, okay, I want to get the bill. They have that set up. They then either go down to Florida or another state for part of the year. Their mail is not forwarded timely, and they've missed premium payments, or they get sick and they're in the hospital, nursing home, they don't get their mail. And if you don't pay your bill, just like your electricity, your drug coverage will get cut off. And most drug companies will not let you make those payments that you've missed and have the plan restart. You would have to wait in most cases till fall open enrollment or another special enrollment that you may qualify for. So you would go without drug coverage. You may have to pay out of pocket for your medication, and some medication is very expensive. So if you do have it deducted from your Social Security check, you know that that bill is being paid every month. And if you are not getting your mail, that's okay. So that's just something to think about. And not reviewing annually. That's another thing to keep in mind. It is not a requirement to review your Part D or your Advantage plan every year. However, it can be very helpful. I have seen many clients, I'm sure Susan has as well, where they come in or a family member comes in and they go, well, I haven't reviewed my plan ever, and I've been on Medicare for 10 years, but I think it's about time that I review. Okay. Well, in most cases, when they have not reviewed ever or in several years, I have found a much cheaper plan for them. One of my first SHIP clients, when I came to be the volunteer supervisor here, she got a hold of me somehow. I don't even know how. And this was still during COVID, so we did a virtual appointment. Well, by the end of that appointment, she was tickled pink for two reasons. One, we found her a plan that was going to save her about $1,000 a year because she had not reviewed it in forever, and she was on a higher premium plan. So she was very excited about that. The second reason was this was her first ever Zoom appointment. She was just so tickled pink that she did a Zoom, and she was going to tell all her lady friends that she Zoomed for the first time ever. So that was a successful SHIP appointment. All right, what else we got? So some other pitfall. Susan, do we have any questions before we go into some of our miscellaneous pitfalls?
We have a question and I have a comment. So go back
Perfect.
one screen.
This one?
Because I just want to offer up an alternative to having something withheld from your Social
Perfect,
Security check
perfect.
or getting a bill monthly. If you don't want an insurance company messing around with your Social Security check, then you can set up an automatic payment that either goes on a charge card or it comes right out of your checking or savings account. Or if it's a small premium and you can afford it, you can just pay the whole thing for the year. Of course, it's always important to check your mail for any changes through the year on all the stuff, and you got to open that stuff and you kind of got to read it, which is a drag because I know we all get a lot of junk mail. So I just thought I would throw in those two alternatives to either having it withdrawn from your social or paying it monthly. I think
That
a
is a
lot of
good catch,
people
Susan.
I
Hmm.
think a lot of people do the automatic
Yes.
draws from their bank account.
Mhm.
And that's also something that you can stop on a dime. If
Exactly.
at
Hmm.
the next year you're picking a new plan, then you can start that up and stop the old one, and you're not having to risk any kind of
Hmm.
double bills.
Good
The
idea.
other
Thank you,
question that
Susan.
came from Janice, which is kind of going back to the beginning of the presentation, Megan,
Mhm.
is she had planned I'm paraphrasing here. She is working for a large employer. She likes her insurance, but it's got a pretty high deductible. So she was going to use Medicare to pay for that deductible. So we need to make sure that Janice understands that Medicare doesn't act like supplemental insurance, right?
Correct, correct. So since it is large employer, the Part B and even Part A would be second. So your employer plan pays first, which means you have to meet that deductible of your employer plan. Correct, Susan?
Correct.
Okay. And then once the employer plan pays, if it does, then the medical provider can look at sending in a claim to your Part A or Part B. But like I said, as secondary, it does not pay out much at all. So, Janice, that might be a good um, time for you to contact a ship counselor and we can kind of talk to you more about that. Or you can contact your benefits individual at your employer and they might be able to give you some guidance too.
Yeah. Thank you. I think that's a common
Mm.
misconception.
Yep. Yep. I get things like that too. Well, I'm going to take both because I won't have any bills left. Nope. Nope.
Right.
When
That's just
Part
not how
B,
it
Part
works.
A is second. Nope.
Yep. And it generally doesn't cover deductibles and
Hmm.
copays and things like that. All right.
Exactly.
Thank you. And thanks, Janice, for making that comment.
Yes. Both of those were wonderful. Now let me get back here. Okay. We did Part D. All right. So some common pitfalls, miscellaneous. Uh, and Susan just touched on this a little bit. Responding to random mailings. Okay. If you don't know who it's from, if it looks too good to be true, don't respond. You do not have to respond to everything that you get when it comes to Medicare, and you will get a lot of things. Um, kind of we're going to jump around a little bit. So down here, ignoring mail. So you do want to make sure that if it says it's from Social Security Administration, Centers for Medicare and Medicaid Services, or your insurance company that you have, those are the ones you do want to open. And if you're someone that's on Medicaid, you also want to open your Medicaid mail from FSSA because there might be things in there that you need to act on and act on quickly. But anything else you can just ignore. You also want to make sure that you're paying your premium when you are out of state. And we talked about that already a little bit. not looking at your Medicare summary notices or your explanation of benefits, depending on if you're with original Medicare for A and B or an Advantage plan or a drug plan. Those are basically how you're going to see your claims. You'll see if a claim was approved, paid, denied, estimated amount that you may owe. It's a really good way to catch mistakes. There are about a billion trillion billing codes out there. And if it was my job, I know I would make some errors. So every once in a while, we do see where a medical provider has put in the wrong code. So the amount that you owe or your approval from Medicare may not happen because that wrong code is in there. So you can catch mistakes with that. My grandmother was in the hospital a few years ago, and she was just in a regular room, but we got her Medicare summary notice, and I looked at it, and they had her down in the ICU. Well, she was never in the ICU. So it was a billing code mistake, but you know that there's a price difference between a regular room and an ICU room. So we were able to get that fixed so we knew how much Medicare legitimately had to pay and what her portion was. It's also a good way to catch fraudulent things with your Medicare number or scams that may have happened and your Medicare number was compromised and now someone's billing Medicare for services you didn't have done or received. So make sure you're watching your claims. And then we have a very important one, not investigating assistance programs. So there are programs out there through Medicaid, like the Medicare Savings Program, that will help pay co-pays, deductibles, premiums, even remove those penalties from your drug coverage or from your Part A or Part B. And then there's extra help that helps with your medication through Social Security. So we can help you with that at SHIP, looking into the different programs out there and assessing you for those or getting you to the right agency that can help you with that. All right, Susan, any other comments or questions?
No, not right now.
Okay. So those are our common pitfalls. If you want to discuss any of those at length or any other issues that you may be having, you can contact us at 1-800-452-4800 and we can help you or get you to a local SHIP site to go over your situation, your questions, your concerns. You can visit us, medicare.in.gov, as well to get some information or to find out the local SHIP site that is closest to you. And we are on social media, which you know that because you're watching us. Susan, would you like to tell the audience what we have coming up?
I would. Okay, believe it or not, next week is going to be July, and we are going to start the month on the 8th of July with an Ask the Expert session. So bring your questions and we will get those answered. It's going to be a casual, just kind of freewheeling session, but you can ask us anything and you'll be able to ask those by writing in. If you want to ask some questions ahead of time, we can save those and answer those during Ask the Expert. That's on Wednesday, July 8th at 10 a.m. Eastern Time. Then a few days later, we're back to Medicare Monday, and we are going to introduce you to our newest team member, Kim Wilkinson. She's down in southwest Indiana. And she's just terrific. She's been a SHIP counselor for years and years, and she's joined the team as a staff person. So join us and meet Kim. On the 27th, to finish the month, we're going to talk about this thing called the birthday rule. And mark this on your calendars, folks. If your birthday is coming up or you still have a birthday for this month and you have a Medigap plan, we might be saving you lots of money with some information about the birthday rule. Many of you know that we have started a virtual Lunch and Learn series, and it's one per month on Thursdays. And our one in July is going to be talking about community health workers and navigators. What are their roles? What do they do? And where can you find one to help you? So those are at noon, hence lunch and learn, um, at noon Eastern time on our Facebook page. So mark your calendars. We've got some great things coming up next month.
Thank you, Susan. All right. Well, thank you all for tuning in today. Like Susan said at the beginning, you can chat in your questions, your comments, and we still monitor those even when we're not live. So we will respond as quickly as possible. Or again, you can call us, call center, and we can help you with your questions that way. So everyone have a wonderful week. Stay cool, stay inside. It's going to be hot. You can contact your local area agency on aging. If your air conditioner is out or you're not in a good location, and they can tell you the local cooling centers that you can go to. And have a wonderful 4th of July coming up as well. Bye, everyone.